So there you go. So on your end, you should click something saying that you're okay with that. Again, the recording is primarily going to be to catch folks up who can make this call. For folks who I don't know or who don't know who I am, I'm Godfrey. My pronouns are he, him. I'm the deputy director at LA Forward. LA Forward is a family of organizations. There's two of them. We have a C3 that focuses primarily on education, awareness, and organizing, bringing people together to make sure that they understand more fully the tools of democracy they have at their disposal as Angelenos. We know that we're not going to live in a full democracy unless we know how to actually bring our own personal experiences and lived perspectives to bear with the government that can help us live the lives that we want to live. And so that's our goal, to help folks understand those different tools. And then we do have a C4 as well that is able to then lift up those voices when they have particular stances around particular policies that they really do think will be better for LA. And so tonight we are doing that. We're sharing a lot of the education work that we've come to rally together around unarmed crisis response, a lot of the things we've learned, but the things we've learned are leading us to come to conclusions. So you're also going to hear some of those conclusions on this call as well. And so this is an LA Forward call, and I'm the deputy director, again, who is supporting a lot of that organizing work, but also helps people make decisions about when and where they want to make those particular stances come to bear on our government. I am going to pass things to Alissa Walker, who supports us on our C3 side of things to put together a variety of reports almost every month for the last 3 months or so called Report Forward. Alissa, if you could share a little bit about who you are, what Report Forward is, and what you did around unarmed crisis response. And I'm going to put the link in the chat box to the most recent work that you did, so that way folks can access it.
Yeah, and I'll just share my screen. Maybe I can even kind of scroll through when I talk about it. But yeah, hi, I'm Alissa. I'm a journalist here in LA, covering all the great work that everyone on this call is probably doing all the time. It was really important for me to, thanks so much to Godfrey and on the Unarmed Crisis Response Working Group that has just shared all of their knowledge. Before I began diving into this topic for Report Forward, every month we pick a different topic, and I kind of spend a few weeks reporting on some of the policies, some of the policy reports and studies, and kind of the research that's going into these issues, and then how the policies translate into action, or changing the way that our elected officials budget for solutions that can help solve these problems. So this was such an interesting topic to go into, and I don't know if you could share my screen, and I can just pull up since instead of looking at me, you could kind of scroll along with me. How do I do that? Wait, where do I go? Oh, share screen. It's just right there. Share screen. Okay. Right, this should work. Oh my God, what is making me do this again? Does this happen every time? It asks me to open up my preferences.
I can share screen, Alissa, if you'd like me
to. Just go to that.
I will do that. I will.
Happened last time.
Great. Yeah.
Okay, so anyway, you can just go to the link. And so what I thought was so interesting when I went into this topic was how ready and excited people were for this solution. Every study, all the surveys that had been done, polling that has been done, Angelenos are so hungry for these types of solutions, unarmed crisis responders, unarmed responders, and even the police themselves are say they're in favor of it. As you saw earlier this year, the LA Police Protective League, which is the police union, quote unquote, for the police, they issued the statement saying that they should not respond to 28 different types of non-emergency incidents, including and specifically non-criminal mental health calls. And so you have this kind of general agreement. Our mayor is very much in favor that the police should not be handling these calls, and yet they continue to, even though we have a lot of these really great solutions. They're underfunded. They're understaffed, and we'll talk more about both of those things. And when we had this big vote last month at this point, or 2 months ago, that actually would increase more spending for police, meaning some money for these things would not get as much money as they were before. What's I think most interesting is to kind of scroll down and look at the data. If you can go to that, go down to, there's a chart that is from the LMU study about 2/3 of the way down. LMU does this big, they've done it every year for the last few years, and they do this police and community relations survey, and they ask people all these different questions about what should police be doing, what are your opinions about how police are perceived, and your interactions with them. And you can see across the board, and this is probably, I think, the best local polling that's done on this topic. Angelenos overwhelmingly agree that the city should not respond only with LAPD officers for calls about sexual assault, substance abuse, mental health crises, and people experiencing homelessness. So you have this like very specific mandate, I think, for what the city should be doing. And what's been interesting too, as I looked into this, there were a lot of people that I spoke with from the controller's office, who is going to be putting out 2 different assessments of what the programs that are already underway. The LAPD actually has its own unit that is supposed to be responding to these types of crises. And as we've seen very tragically in many situations, either they're not called, or they're not called in time, or they're not able to get to the scene, and people, their services, if they are helpful, are even not being deployed in a way that can prevent some of these tragedies from happening. We've had many of them. At the beginning of this year, we had 3 people who were killed in 10 days. And one of those cases, they actually determined that the police were out of policy for the death of Keenan Anderson. And we can talk more about that later too. The other thing that was really interesting was talking to the council members. There's some of the council members who are very adamant about getting some of these solutions deployed. And we'll talk a little bit about Circle, which is one of the programs that is was just announced an expansion to Sherman Oaks, which is really great. But again, it's like in very small parts of the city, and it doesn't have the ability to, be staffed, 24/7 and to respond to all the different crises. And I talked to in CD1, Amy Hernandez, and it was really interesting, mostly to hear from their solutions that they're trying to put out in CD1, where they kept running into this issue about dispatch, the way that our dispatch is structured in the city. And I didn't know this, and maybe you all do because you're involved with this issue, but I did not know until I started reporting this, that when you call 911, you are calling the police. Like for any type of emergency, it goes through LAPD, they route it. And even when you call the number that is the non-emergency line, I did not know this, I dialed this number that starts like 877, it actually stands for Ask LAPD, because you are also calling the police when you are calling the non-emergency line. I did not know this. So this was really interesting to me to hear how difficult it is to get anything besides a police response, because that's the way that we have set this up. And finally, as talking to all these different programs, all these different groups, we're going to go into these in more depth. What was most interesting to me was talking to one of the programs that is being funded by CD1, which is a street medicine team. And talking to that team was really interesting, because they said, a lot of what we do is not even a crisis. It's not even considered to be an emergency or a crisis, but we're, those calls are still coming through, and we're just trying to help people. So it's almost like we even saying unarmed crisis response, it just needs to be unarmed response. And we need to find a way to connect the people who need help with the people who can help them in the right way as fast as possible. And that's going to be what we're going to talk about tonight.
Thank you so much, Alissa. And again, the link is in the chat box there if you all are interested in looking at that more and haven't yet looked at it. We want to give you all insight too on how LA Forward got into this issue and sort of how far we're getting with a lot of our organizing work, such that we're even leveraging policy newsletters and bringing a guest speaker to you tonight around this particular issue. So to share sort of that trajectory, I'm going to pass things to Jason Enright and Mia Levis Porter, who will then introduce our guest speaker.
Hi, everyone. So my name's Jason Enright, and For me, this all started at the beginning of the year. Godfrey sent out this newsletter saying that they wanted to convene meetings in each city council district, and gather together people and just kind of talk about what issues really mattered to us. In fact, there are a bunch of people on the call tonight that were at the very first meeting we had in CD2. And as we talked at those meetings, one thing that kept coming up is people having these stories where they encounter someone with mental health issues, they encounter someone homeless on the street, they want to call and get that person some sort of help, and they didn't know who to call. They didn't want to just call 911. They weren't sure how to best get that person help. I had stories like that. Everyone we talked to at these meetings had stories like that. So then we started researching, we started looking into this, started talking to council members, talking to people of the city. What we very quickly learned was that there were programs being piloted in certain parts of the city that do this kind of unarmed response, but they were very few and far between, and they hadn't gotten any budget increases in a while since they'd been launched. So the first part of our advocacy really became, how can we get the city to put more money into these programs? That's what we did from April to June. We worked, we went and we made public comment. We did one of these kind of meetings where we had you all go and send emails with a form. We sent like over 150 emails to people. We made a bunch of public comments at City Hall. We won $15 million additional for the year's budget to be spent on these kind of issues. We also, through putting some pressure on City Hall, we won a circle team for Sherman Oaks that actually just launched November 1st. So that is now active. I actually just got a picture sent to me from CD4 of the flyer they're going to be passing out, teaching people how to use Circle, how to call Circle. So that is happening right now because of the work of this group. We also got the city to agree to create an Office of Unarmed Crisis Response and really make this a priority for the next couple of years. And we're going to get into a report later on tonight, talks about more about that. But then we realized we weren't done there. We started hearing a lot that this was bigger than just the city. So I'm going to pass now to my friend Mia, who's going to tell you about the work we started doing with the county.
Hi, everyone. Mia Levis Porter. I'm from CD13. I'm a Moms Demand Action volunteer. I had lost my brother to gun suicide after his 5-year battle with schizophrenia. So for me personally, when I heard of Angelo Quinto up in Antioch, California, he was having a mental schizophrenic episode. His family called the police, and he ended up dying because the police put pressure on his neck and he died. That was re-traumatizing for me. So that's why I have been happily, enthusiastically volunteering with LA Forward. So as Jason said, we started this mission trying to figure out things on a city level, but the more that we dove into these conversations, the more we realized that we needed to take it a step out. And so we started talking with behavioral health urgent care centers in Antelope Valley, other service providers. There's from the county Office of Violence Prevention, there was a post-crisis response pilot team. And we continue to meet with electeds up and down the levels of government, from the Board of Supervisors, Assembly, State, Senate, to congressional offices. We learned so much about the programs that are out there. And what we found, unfortunately, is that so many of them have incredible ideas and programs, but they're working in silos, which is why what we are doing at LA Forward is so important. As an activist organization, we've had the ability to connect with offices and services that might not normally be able to connect with one another. And after 30 meetings, now we are ready to connect the dots. Alissa's report forward is the start of that, including tonight's teach-in. And so many of the meetings we've had, people have been grateful for what we are doing because they all want the same thing, which is compassionate support for those who are struggling, preferably by trained, skilled support technicians instead of independent of law enforcement. And of the 3 dozens of meetings that we've had, many shared that they felt that when it comes to mental health, LA County has the strongest foundation for mental health, which brings us to our next speaker, Kyla Coates, who is the Justice and Mental Health Deputy from LA County Supervisor Janice Hahn's office. Alternative crisis response is her jam. We learned so much from Kyla and are excited for her to share an overview of the current state of mental health support at the county level. And by the way, if you have any questions, feel free to drop them in the chat. Alissa will moderate a Q&A at the end of this program. So put your questions in the chat, and Kyla, take away.
All right. Thank you so much, Mia. And hi, everyone. My name is Kyla. I do work for the county, not the city, but I'm here today because, as Mia said, the LA County Department of Mental Health is actually the mental health plan for the entire county of Los Angeles. So all of the funding for mental health care in terms of the Mental Health Services Act comes through the County of Los Angeles. And if people go through insurance, whether that be private insurance, Medi-Cal, or they're uninsured, it is the Department of Mental Health Care that goes through that's run through the county. So that's why we really have stepped up to the plate at the county level to be alternative crisis response for people who are experiencing a mental health crisis. So I'm going to focus my overview today, and I'm going to try and be brief. I'm going to focus my overview on the mental health component of alternative crisis response, recognizing that there are a lot of other opportunities for alternative response, like responding with social workers to non-emergency calls that are non-crime related, or responding with homeless service providers to homeless related calls. But I'm going to focus today specifically on mental health calls and the alternatives to police and paramedics that LA County has built up with the goal of intervening at all parts of the spectrum. So I'm going to try and share my screen to get us started. See if this works. All right, did that work? I see some not great. Okay. Yep. So at LA County, we believe that alternative crisis response is essentially three things. It's having someone to call when you're in crisis, which for too long has been 911, right? That's been the only number that people can call when they're experiencing a crisis. Then it's having someone to respond, which for too long has been only police and only paramedics. And that's not always the most appropriate response, especially when someone is having a mental health crisis. But then you also need somewhere to go afterwards. And for too long, that place to go has been jail, let's be honest, or it's been the ERs, right? And ER is also not an appropriate place when someone is experiencing a mental health crisis. People are not, they're not getting the services they need there. And it takes very needed beds away from other physical health emergencies when they really should be treated in a mental health facility. So we have those kind of three components, and that's what LA County's Department of Mental Health, what our alternative crisis response work has focused on. So I'm going to go ahead and start with the first part, which is having someone to call. In July of this year, 988 launched nationwide as the national number for suicide and mental health crises. This was a bill that was passed by Congress, signed into law, and we launched at the national level. So anywhere in the country that you are, if you dial 988 on your phone now in the United States of America, you'll get routed to your county's suicide crisis response line, which is amazing because for too long, you've had to memorize a number for a suicide line, 1-800-TALK, or wherever you are, it depends on a different number. Now it's an easy to remember 3-digit phone number. In LA County, we've decided to take that a step further because we wanted to take advantage of the fact that this is an easy to remember 3-digit number. So we have the county has partnered with Dee Hirsch, who runs our 988 call center, to be able to transfer calls to our LA County Department of Mental Health line to provide mobile crisis response teams. So if you dial 988 from LA County and you get routed to the LA County call center, not only will you be able to talk to a trained suicide response counselor who can talk to you over the phone, but if you need an in-person response, either for yourself or for a loved one that you're calling on behalf of, or a stranger that you're calling on behalf of, they will transfer you to the LA County Department of Mental Health line that can then send out a team depending on your needs. And so not every jurisdiction does that. I want to be very clear. LA County is unique. We were the first ones to implement this. A lot of others are starting to do it as well, which is really great. So the next part to that then is what happens when you do need an in-person response? You need someone to respond. And we do not always want that to be police. In fact, most of the time, mental health crises do not need a law enforcement response. So the County Department of Mental Health has made different types of teams. We call these field intervention teams, or FIT, as you can see on this screen. And they're teams of a licensed mental health clinician paired with either a peer, who's someone who's been officially licensed by the state of California as a peer provider to talk as someone with lived experience to someone else who's going through a mental health or substance use crisis. So a mental health clinician paired with either a peer, or we have psych techs, which are another type of licensed professional who's trained to deal with mental health crises. And they respond in unarmed, unmarked vehicles to the person in crisis. They're trained to interact with them. If they need to be transported to a hospital or to a psychiatric urgent care center, they're trained to arrange that, to sometimes take them themselves. Or if they don't need to go because they're able to de-escalate in the field, which is obviously the goal, then they are also able to set up a follow-up appointment with the Department of Mental Health, or help them find resources in their area, maybe through their insurance or through the county department. And so these are kind of the most, in my mind, the most exciting part of our work, because it's an alternative to police, it's an alternative to our firefighters, and it's people who are trained to meet you where you are when you are in crisis. And I want to be very clear that these run across the entire county of Los Angeles. So they do hit all of Los Angeles City, right? Depending on where you live in LA City, you're in a different county service area, but there are teams across the entire county. So no matter where you are, if you call 988 and you need one, you will be able to get one. And then, of course, the last part is you need somewhere to go. And as Mia, you referenced the behavioral health urgent care centers. These are kind of newer in the department in LA County. They've been around for the last few years, and they're essentially like urgent care. So that you can drop in, you can be dropped off, you can be taken there by an ambulance, you can even be taken there by law enforcement, you can walk up yourself, but they're specifically for people in crisis. It is a short-term crisis. They are there for stabilization. They are there to link you up with long-term treatment. The stays have to be under 24 hours. If you need more than that, then they will get you to a hospital bed or a mental health hospital bed, not a regular hospital bed, and they will provide those follow-up services. But they are there for that moment of crisis, de-escalation, make sure that you get what you need and you're being watched, especially because of the worry of harming yourself or others. So we have these all across the county as well. We don't have enough of them, to be honest. We need more. We're currently building them more because of some state grants, which is awesome. But almost everywhere you are in the county, you do have access to go to a mental health urgent care center if you need one. So I'm going to stop sharing my screen for a minute because I want to stop share. Okay. I want to switch a little bit now that I've given you kind of an overview of what we have. I want to talk about the needs and how the county is developing tools for any type of need. So the response that someone needs is going to depend on the level of their crisis, right? So I kind of think of those as being in 3 tiers. There are people who can be de-escalated and counseled over the phone without any type of in-person response. And that's why 988 is so great, because they are 24/7 phone counselors who are trained to deal with suicide. They're trained to de-escalate. They're trained to deal with mental health crisis. 95% of the calls that they get to 988 do not require an in-person response. They are counseled over the phone. You can reach 988 obviously by calling 988, but also we acknowledge that there are still going to be people who call 911 because they haven't heard about 988 yet. So we need to also put systems into place to divert those calls that are more appropriate for 988, but that end up at 911. So DD Hirsch has already partnered with the city of Los Angeles, and LAPD and DD Hirsch have a 911 to 988 diversion, where if LAPD, as you said, Alissa, they get the calls, if their dispatch person says this doesn't need a police response, this person could be counseled over the phone, they will send it off to 988 immediately instead. We're working on establishing that with the sheriff's department in the county. That's going to go live in the next couple months. And we're hoping to do it with more police departments across the county, but we're starting kind of one by one because each jurisdiction is different. So that's your first level, right? If you only need an over the phone response, And we want to make sure we get it from whatever angle. If you call 988, great. If you call 911, we still want to make sure you can get that over the phone response. But then you are going to have people who need a higher level, who need an in-person response. But they do not need an armed in-person response, and they do not need an ambulance in-person response. They need a mental health mobile crisis response. Those are our psychiatric mobile response teams that the county has created. They are almost 24/7, guys. We're almost there. In the next month, they should be 24/7. From right now, they do not run from 2 a.m. to 7 a.m., but in next month, we should have them 24/7. It's been a journey to get them there. They're the pairs that I talked about. We call them PMRTs, as Godfrey put in the chat, and they run across the county. You can reach them by calling 988. You can reach them by calling the DMH line directly, right? If you don't want to go to 988 and then get transferred, you can call the DMH helpline, which I can put in the chat as well, but it's 800-854-7771. Or once again, we need to make sure that if you call 911, you can get a PMRT. And so that's kind of been one of our biggest challenges. And so we've created what's called the therapeutic transport vans. And this is a pilot program. And actually, it only exists in the city of LA. So if you guys live in LA City, you're the only ones who have this pilot program where we have vans, they're therapeutic transport vans staffed by a mental health clinician and a peer. They stay at fire department stations. And when the fire department, LAFD, gets a 911 call for paramedics that they say, actually, this isn't a physical health issue, this is a mental health issue, they have the ability to dispatch the therapeutic transport van themselves. So that is an innovative new pilot program. We're seeing how it works with the city, who was very, excited about this pilot. So we started with them. And if it is successful there, we will expand it. Of course, we want to get to a world where people know when to call 988 and when to call 911, and they make that choice on the front end. But we have to be realistic and recognize that there are still going to be people calling 911 when 988 is more appropriate. And that's why we put that system in place. And then finally, the third tier, and we're going to have to be honest here, is a type of mental health crisis that does need some type of law enforcement. Either the person has a weapon and is threatening to hurt themselves or the people around them. And so what we do not want is what we see too often, which is when law enforcement responds who are not trained in mental health response, or, they took 1 5-hour training one day 5 years ago, right? And they don't actually have any de-escalation or communication or mental health experience. And they respond and they use force as if they're working with an active hostage situation or a criminal situation of someone who doesn't respond to their demands because the person is in the throes of a mental health crisis. So the county has created mental health, what we call co-response teams, where they are specific deputies or police officers who have gone through 800 plus hours of mental health specific training, paired with a licensed mental health clinician, and they respond together as a team. So the city of LA has these teams. They're called SMART. The county of LA with the sheriff's department has them. They're called MET, Mental Evaluation Team. I don't know what SMART stands for, but I could look it up. We have some with other police departments that are called LET, law enforcement teams. But the cities and the counties are the biggest ones because they respond together. Whereas some of the smaller police departments, right? Like I live in Pasadena, the Pasadena LET, they don't respond together. Law enforcement responds first and then calls the team. And we do not think that is an ideal situation. That leaves too much time. So we have these co-response teams that are the model of MET and SMART. Studies, facts, statistics show that when these teams respond, the people live. And that is way too low of a bar, but that is the reality of the situation that we are talking about. And that too often is not the case when our non-co-response teams respond to people in mental illness. So these are very important teams. We want them used as little as possible, but in this situation that we need one, we need to make sure that people are trained adequately. So that's kind of an overview. I don't want to take too much time because I know it's late, but we have 988, we have 911 to 988 diversion, we have mobile crisis response teams, and we have law enforcement co-response teams. And that's kind of the overall spectrum. They're available all across the county. Now, one I was told to talk about challenges because this is a brand new system and we have built this up in the last year and it is not where it needs to be yet. So I'm going to be very honest and talk about a few challenges we have. One, I think someone referenced this earlier, is hiring and retention is a huge challenge. I mean, we are in a mental health crisis around the state and the country, which means that mental health professionals are in incredibly high demand, which is awesome for people who go into that profession. It is very hard to recruit people in this profession to do these type of jobs when they also have job offers from Kaiser where they can do telework, right? Or they sit at home. These are hard jobs. They are in the field. They are overnight, right? We're trying to be 24/7. So we have been actively at the county trying to pursue signing bonuses, stipends, bonuses for working overnight, bonuses for working in the field, flexible schedules, right? Can you work 3 days on and then you get 4 days off? We're trying to be flexible. We're trying to make this job more incentivized for people to come into this field because we cannot create a system that acts as a true alternative to 911 until we are adequately staffed. If we do not have enough teams to respond, people are going to be told, I can send you a team in 2 hours. What are they going to do? They're going to put down the phone. They're going to call 911 because they don't want to wait 2 hours. So that is our biggest challenge right now. We're making incredible progress. We actually have a new hiring campaign. If you guys know anyone who's interested, it's called Do Worthwhile Work. And I'm going to show you. It's pretty amazing. The LA County Department of Mental Health is all about doing work that matters. We have a brand new hiring campaign talking about the meaning behind the work. And then another challenge that I do have to mention briefly, because something I hear a lot about, is 988. When 988 was created at the national level, it was created so that the call was routed to the call center based on your area code. So if you have a 626 area code, like I do, I'm from Pasadena and I live in LA County, I'm going to be routed to the LA County call center, no problem. But if I moved here from San Francisco or Chicago and I have an out of county area code, which I don't know about you, but a lot of my friends and family do, right? We're Los Angeles, people move here from everywhere. You're going to get routed to your area code call center from home. They don't do mobile crisis response teams. They can't refer you to the Department of Mental Health to send out a team. So it has caused a huge problem, not only in the fact that people aren't getting connected to mobile crisis response teams when they need it, but also in people being discouraged because they read an article and they think, oh my God, great, I can call 988 the next time I need to. They call and they're told, what are you talking about? We don't do mobile crisis response. We can talk you through over the phone, call 911. And then, I mean, the amount of people I've heard say, I had a terrible experience. They don't do it. It's not working. They hang up. They're never going to call 988 again. So we actually on the county level have not been advertising 988. I don't know about you, but there's not a lot of posters around there. They should be everywhere, right? We have not been trying to get the word out there as much as we would because we don't want people calling 988 and then never calling again because they got routed to the Chicago call center. So this is a huge problem. But the good news is that there was a bill that was introduced. Supervisor Hahn and myself actually went to DC in April. We talked to Congressmember Tony Cardenas, and he introduced a bill. It's HR 4974, the Local 988 Response Act, and it would implement what we call geo-routing, which is not geolocation, so it does not give out your exact location like 911 does. It simply would route the phone call to the county based on the nearest cell phone tower. So it's where did you ping a cell phone tower and you'll get routed to LA County. It would solve all these problems. We're really hoping it's bipartisan so far. Mental health is not a partisan issue. Everyone should care about this. We really want it to pass. So that was my other really big challenge. I don't want to take more time, so I will pause with my overview, but always happy to talk more. And the Department of Mental Health has a really great website. If anyone's interested on alternative crisis response, just go to dmh.lacounty.gov and you can find information about 988 or ACR, and it lays out all of the programs, how to reach them. It has even a chart of when to call 911 versus when to call 988. Really great resources.
Thank you, Kyla. So I'm going to be taking it from here. Just a reminder, my name's Jason Enright. I'm from the working group on unarmed crisis response. And Godfrey, if you can bring back up the PowerPoint. So recently the city put out a big report called the CAO report. The CAO is the City Administrative Office. And essentially, anytime the city wants to act on something, they ask one of the city departments, hey, do a big report and make recommendations for us on this. So we can probably put a link to this report there, or I also made like a cheat sheet where I broke the 40-page report down into like 5 pages. But basically, I'm going to go through that really quickly. Godfrey, we can go next slide. The first part of the report was all about our current pilot programs. Just so you know, the county's doing this great job on mental health, but there's other things the city would like to have unarmed crisis response for. So there's things like Circle, which is a program to you can call to help or to help with unhoused people, unhoused issues, things like that. Like they mentioned, like Kyla mentioned, there's the therapeutic van program. There's a sobriety emergency response program, and a lot of these used to be led through the LA Fire Department. Circle is run through the mayor's office. But what the city council is moving towards is they want to build an office of unarmed crisis response, and they want to launch a new pilot program that's going to start to bring more of these together under one program. So on the next slide, we'll talk a little bit about the UMCR pilot program that's launching. This pilot program is going to launch in 3 areas, and it's going to cover things like mental health, substance abuse, suicide threats, behavioral distress. It's going to basically cover everything Circle doesn't cover. And it's kind of their new thing they're trying out. And this new pilot program, they set aside like $5 million for. But again, it's this thing where they keep trying all these different pilot programs that do different things. And what we've really been pushing for is trying to get them to move to like one program citywide. So if we go to the next slide, we can show you how the current services across the city look. So if you look at this map here, the 3 areas in red are this new pilot program that's going to cover basically things that Circle doesn't cover. And then these other colors here, there's an orange color, there's purple, yellow, green. Those are the current Circle pilot programs. As you can see, we're starting to get more of the map covered with unarmed crisis response in the city, but still huge chunks of the city are not covered by anything. As the report continues, it starts to talk about next steps after this. So they want to establish an Office of Unarmed Crisis Response. Basically, this would be within the CAO office. It would be overseen by both the city council and the mayor. The goal of this office is to bring all the existing and future programs under one office and streamline them into one service. The main goal right now is a lot of data collection and analysis. They want to see which of these programs are working, what's not working about them. So as they bring things together, they can maybe eliminate redundancies and also find gaps in the system for what they need now. They also are trying to create structures for call triage and dispatch. We're going to get more into that in a minute. A big component of this is how the calls are answered and how the services are dispatched. And then the final part of this office is going to be coordinating with the excellent services the county's already providing so that there's less overlap. So the next we have the 5-year plan for unarmed crisis response. Basically, where we are right now is they're trying to finalize the scope, gather the data, analyze all these service gaps, figure out what this program really needs to look like. Next year, their goal is to create this Office of Unarmed Crisis Response, hire the key staff, look over all the current contracts they have with all these different service providers, figure out what they're going to continue, what contracts they're going to extend, what contracts they're going to roll into new programs, and what contracts they're going to terminate. And throughout this, they want to continue community engagement. They want to keep hearing from us on what's working and what's not working. And then if looking ahead years 2 through 5, so that's going to be 2024 through 2029, they're looking at actually building this out so that hopefully by the end of 2029, the whole city will have unarmed crisis response services under this new office, sort of all answering to the same people. Instead of all these various pilot programs, there'd be one simple program. And then on the next slide, I want to talk about the sort of the key challenges we noticed in this report that the CAO pointed out, which is going to lead us into our action item for the night. One of the big problems right now is that when you call 911 or you call Ask LAPD, you know, that non-emergency number, no matter what you're calling for, LAPD, fire, circle, Department of Transportation, any kind of unarmed crisis response, those calls go to the police department. The police department handles all of our emergency response system. But then after they answer you questions, they triage the call, figure out where it needs to go to. When they transfer you over to LAFD or they transfer you over to an unarmed crisis response program, those people are on a different computer system, a different database. They have to ask all those questions again to figure out how to dispatch your call, you know, to figure out what you need. That adds time to the response time, right? If they made a mistake, they need to send you back to LAPD, it's going to happen again. Or they need to instead send you to LAFD, they're going to ask you all those questions again. So one of the best practices suggested in this CAO report is to consolidate all of these systems, all these computer systems, all of these triage questionnaires into one program so that everyone is working on the same database. So that when Ask LAPD asks you, you know, where's the crisis at? You know, what kind of service do you need? Asks you all these questions. That's all put into a database. So when they transfer your call, it's already there for the next person to look at. They want to ease these communications and lower call times. There's also the idea of trying to get more of these programs to use the same radio systems so that if someone on the call needs to call for backup, needs to call LAPD to come in and help them or call LAFD in to help them, they don't need to call back to the emergency dispatch system. They can just call directly over the radio. The other big part of this that has come up is that if we're trying to move away from an LAPD focused system, from a armed crisis response system to an unarmed crisis response system, or even just incorporate that unarmed crisis response system, we need to look at moving our emergency response out of LAPD. Because right now it's LAPD trained people who take those calls. They've been working for years on the idea that who you send is LAPD. We want to teach them a new way of doing that. And if we're going to go through all this training, we're going to build a whole new system anyway. The best practice suggested by the CAO report, based off how they do it in other cities that have launched this, is to relocate that dispatch center outside of LAPD, because we want to kind of get away from the idea that if your only tool is a hammer, everything you look at is a nail. We want to have people who are trained not as police officers first answering the calls so that they have a better mindset for triaging these calls and deciding what needs to be done to answer them. So that leads us to our action item for the night. At LA Forward, we've launched this new website, which you can see here for the first time, that is going to take you to a one-click email system where you put in your information and you will send out this email to your city council member, to the mayor, to the people who represent you, that's asking them this simple ask: as you build this new program, as you build these unarmed crisis response programs, we need you to create a centralized dispatch system that includes the unarmed crisis responders, includes county mental health responders, and doesn't assume LAPD is the default response to crises. This has language taken directly from the CAO report's best practices, where we're literally asking them to do what their own experts suggested they do. And we just need to let our city council members know to sort of help build that courage for them to take the proper action. And I believe I am now passing it back to Alissa, who's going to start any Q&A.
Thank you. I mean, this is really it. I think this is like exactly what you said. It's taking the recommendations that are in this report, and Jason's summary of it is so good. Please save it and spend some time with it, because it's really it just really it's kind of wonky, the language, as all the city reports are. This one's a really explains it in a way that you could understand it, and explains like why some parts are just kind of like you can tell through their report, like they've obviously thought a lot about it, but it needs a little nudge from folks in the community to say this is what's really important. And through my research, going through reporting this story, this was something that came up over and over and over from both responders and council members. I'm not seeing any particular questions in the chat at the moment. I'm wondering if anybody wants to raise their hand. I can't see anybody. Do I need to be? I don't know if I can see everybody. If anyone wants to raise their hand and ask a question, I can't. I'm scrolling through. If anyone has any feedback or wants to make any comment. Oh, Erica says, one question I have is, how do we balance urgency with the need to pilot programs? And then is there any follow-up? Susan asked, is there any follow-up we can do? Okay, well, let's maybe, and then I see someone with a raised hand. Oh, everybody's got tons of questions now. Okay, who has a raised hand? Jorge, do you want to ask your question? And then I can go through and kind of read through some of these.
Yeah, I was, hi everyone, Jorge Rivera, he, him with the Healing and Justice Center. We're just LA County based, but really appreciate you all doing this work. This is really important work. So thank you so very much for all of that and the information. I was curious about the paired response with the police officers. Has there been any discussion, or do you know if those police officers will show up in like a police vehicle? Will they show up in uniforms? Because given sort of like the general distrust, especially with people having mental health crisis, how that may pose like an opposition or a threat. And I was just curious if that's been that's part of the plan.
Yeah, Alissa, do you mind if I jump in there?
I was going to say, you should.
Yeah, that's a great question. And you're absolutely right on the nose. Is at least our county MET team, which is the co-response, does not ride in a sheriff's department vehicle. It is a white, SUV vehicle, painted white. It doesn't have sheriff decal or anything. And the deputies don't wear sheriff's department uniforms. They're basically like black polo shirts. And I think they say like MET team on, the pocket square, but no, they don't, because we're very conscious of that. So really good question.
And that definitely came up a lot in conversations, especially, just the response and the vehicle makes a big deal. And wait till you see these amazing therapeutic vans. Like if you can look them up online, or maybe we could share photos of it or something, or someone could, we could do that as part of something in a future event. But like, these vans are amazing, and they have everything from, medical supplies to like socks. And it just makes a lot of sense to have that be the thing that shows up, because you just don't know what the crisis is going to be. And maybe they just need socks. Like it sometimes can be as simple as that. Looking at, is there any follow-up we can do with the measure, that Kyla mentioned, the one that at the federal level? Should people maybe reach out to?
Yes, please reach out. It is in Congress now. It has not had a hearing yet. So reach out to your congressional representative, whoever it is, and please tell them to support HR 4974, the Local 988 Response Act.
And we can share that again. If you can scroll back, and we can link that again. Jane asked, what happens if you dial 988 and your area is not covered? I believe you were saying that everyone
will get to a call center, right?
Yeah.
But you'll get to the call center from your area code. So if you are, let's say you're from Bakersfield, I happen to know that Bakersfield County doesn't do mobile crisis response, right? So you'll get to them and they'll say, what county are you in? or they should ask you what county you're in. And if you say LA, hopefully they can transfer you to the LA County. However, that doesn't always happen. I would say, in fact, it happens less than 50% of the time because, that's not first thing in their training is how to transfer calls to LA County. They're dealing with suicidal crises. That's what their training is focused on. So honestly, they might just say, we don't respond there. I can have you talk to a representative, or you can hang up and call 911. So I recommend, if you need a mobile crisis response team and you know that your area code is not an LA County area code, call the DMH helpline directly. And that's 800-854-7771. Just Google DMH helpline, and they will be able to get you a team.
Question from Jean Paul: how can the city help the county when it comes to building facilities for mental health crises? I feel like that's a big one.
That's a big one. I'm not sure the city can do much, but we can support the state in giving us money, because that's really, especially for big infrastructure, we're talking millions and millions of dollars, right? So the state has been really great at giving grants, which is why we're able to build so many. One thing that I didn't mention that I was thinking of after all the talk of the CAO report is we are very excited to partner with cities, and we love the idea of cities doing their own crisis response teams and programs. One thing that I am worried about is having too many silos and too many numbers that people just get confused and they don't know what to call, right? And that's the beauty of 911. Wherever you are, you call 911 and you get routed to your city, whether I'm in Pasadena or LA or wherever, I will get taken to that city's police department. I envision 988 should work that way. So if the city wants to implement their own mental health crisis response team, right? Not these other alternative programs that they're doing, but mental health, I think that's great, but we should make sure that the city works with the county to connect it to 988. So that if you're in LA City and you call 988 because you've been told that's what you call, and they say, oh, you're in the city, we actually have a city response team we can send to you, right? We don't want to have another number and have people having too many numbers. So I would encourage, when you do talk to anyone on the council, we should not be creating separate systems. If you want to create your own LA City tailored mental health team, that's great, but let's make sure it connects to 988 because that is the countywide national network, and let's support each other instead of creating separate ones.
So Kyla, I didn't cover it in this quick thing, but there is a section of the CAO report that talks exactly about how they want to connect with county and handle warm handoffs back and forth and tie in 988 with all of that as well.
Awesome. Because my vision is if you're in the city and you call 988 and the city has their own teams, 988 should be able to dispatch those, right? Or send it to the city to dispatch them. It shouldn't have to be a county team because you're calling 988, right? That's not how it works with the police. If I live in Pasadena and I call 911, I get a Pasadena Police Department. I don't just get the sheriff, right?
We can stick around and answer more questions if anyone has more and want to stay, but I just want to close for people who want to jump off at 8. Throw it back to Godfrey real quick for last steps.
Thank you so much, everybody on this call. Thank you, Alissa, Kyla, Jason, and Mia for putting this call together. We have a couple of next steps. You all saw that we are trying to create public energy around the need for a more centralized set of systems that we eventually need to move forward, because right now the city and the county have disparate services that are building, and we do want to make sure that no matter where you live in LA City, that you have the opportunity to get to the alternative crisis response that you need for either for yourself or somebody that you are seeing and caring for. And so, make sure you head to laforward.org/unarmed-dispatch. And that sends an automated email out to your council member. Then share that link out as much as possible. And we are following up with council offices as well to see what they can do there. If you're interested in all of this work that we've been doing, many of you know this, we've been meeting on Mondays, on and off, depending on what part of year it is, but pretty much Mondays throughout the year. And you can join us at tinyurl.com/LAF-unarmed-signup. You see that underneath there. Someone could type that up and put it into the chat box. That would be great. But you can just sort of keep up with our work by joining those calls or just being on our mailing list when we push those out. If you want to read more, we've talked about Report Forward, we put the link out earlier in the chat box, the CAO report or the summary that Jason put together. And then just some things that are ahead of us. Because we are trying to break silos, we are convening different offices of elected officials over on December 1st, actually, from the local level, city level, all the way up to the federal level, to get them to talk about this together. This is ripe time to intervene on the conversations our elected officials are having, because they are going to start thinking about budget items for 2024. They're going to start thinking about policy and legislation that they're proposing. So if we are trying to create a coordinated system, now is the time to get them talking with each other and ensure that they are only moving in different directions if it's strategic. Otherwise, we ought to be moving in similar directions so that we make life a little bit simpler for Angelenos to benefit from this. So those are some things that are happening up next. We are going to stay online in case there are questions that folks have that they want to continue to talk about around this topic, but we also know that 8 p.m. was what we put out there in case folks have a hard stop or just need to go take care of life and all of that. So thank you so much for those next steps. Alissa, back to you. I know there were a couple other questions.
Yeah, thank you. I see, Jorge, you had your hand up again. Do you just want